There's something that happens every single morning to millions of people over 60, and almost none of them take it seriously. You open your eyes. The room is still dim. And before you even think about the day ahead, your mouth is already telling you something is wrong. It's dry. Not just a little dry. Parched. Like sand. Your lips are cracked at the corners, your tongue feels thick, and the first thing your body is reaching for, before coffee, before anything, is water. And you think to yourself, I probably just slept with my mouth open. So you drink your glass of water. You brush your teeth. And you forget about it. Until tomorrow morning. When it happens again. I want to stop you right there, because that dismissal, that small moment of brushing it off, could be costing you something you cannot afford to lose. Your health. And in some cases, precious time for early treatment. My name is Dr. Name, and today I want to talk to you about something that gets almost no attention in routine checkups, waking up with a consistently dry mouth and cracked lips. Because this is not just a nuisance. For many seniors, this is the body's quiet, persistent, early alarm. And alarms, when ignored long enough, stop feeling like warnings. They just become background noise. That's when the real damage begins. So let's slow down today. Let's listen to what your body has actually been trying to tell you. The medical term for dry mouth is xerostomia, and before you think this is rare, studies suggest that nearly 1 in 5 adults over the age of 65 experience it regularly. That number rises steeply when you factor in people on multiple medications, people with undiagnosed metabolic conditions, and people who simply don't drink enough fluids through the day. But here is what makes this genuinely important to understand: dry mouth is almost never the disease itself. It is a symptom. A signal. A window into something deeper happening inside your body. And when it shows up every morning, reliably, stubbornly, despite drinking water at night, your body is not being dramatic. It is being precise. It is pointing at something specific. And the question we need to answer together today is, what, exactly, is it pointing at? Let's start with the most common cause, one that is incredibly easy to overlook because it hides in plain sight. As we age, the sensation of thirst weakens. This is not a myth. This is documented, measurable physiology. The hypothalamus, the part of your brain that monitors fluid levels and triggers the thirst response, becomes less sensitive with age. Which means your body can be running significantly low on fluids, and never send you the signal to drink. You are dehydrated. And you don't even know it. Chronic, low-grade dehydration in seniors is far more dangerous than most people realize. It doesn't just cause dry mouth. It thickens your blood, strains your kidneys, reduces oxygen delivery to the brain, and over time, it accelerates cognitive decline. But here is what makes it particularly sneaky at night: your body continues losing water while you sleep. Through breathing. Through skin. And if you haven't hydrated adequately during the day, by the time you wake up, your body has been running on a deficit for 8 hours. Your mouth knows. Your lips show it first. Now, if dehydration were the only cause, we could fix this simply. Drink more water. Done. But for a very significant number of seniors waking up dry every morning, the cause is something sitting right there on your bedside table or bathroom counter. Your medications. This is the one that surprises people the most, and it is critically important for anyone over 60 taking multiple prescriptions. More than 400 commonly prescribed medications list dry mouth as a documented side effect. Read that again. 400. Blood pressure medications, particularly diuretics and ACE inhibitors. Antihistamines. Antidepressants and anti-anxiety medications. Bladder control drugs. Certain pain medications. Muscle relaxants. Even some common over-the-counter sleep aids. When you take these medications at night, which many seniors do, they are actively suppressing saliva production while you sleep. Your salivary glands slow down. And you wake up with that familiar dryness, that stickiness, that cracked feeling on your lips, not because something is wrong with you, but because of a side effect that nobody ever properly explained. This matters enormously, because it is fixable. A conversation with your doctor or pharmacist about timing, alternatives, or dosage adjustments can make a meaningful difference. But you have to know to ask. And then there is a cause that I want you to hear very carefully, because this one is not about medication. This one is about a condition that affects tens of millions of people, that progresses silently for years, and that carries serious consequences if it goes undetected. Type 2 diabetes. Persistent dry mouth, especially when accompanied by waking up frequently at night to urinate, unusual fatigue in the mornings, or an inexplicable increase in thirst throughout the day, is one of the most consistent early warning signs of undiagnosed or poorly managed type 2 diabetes. Here is the science. When blood sugar is elevated, your kidneys work overtime to filter and excrete the excess glucose. That process pulls enormous amounts of water from your tissues. Your body becomes dehydrated at a cellular level. Your salivary glands are affected. And every morning, your dry mouth is not just dryness. It is a metabolic distress signal. For seniors over 60, the risk of undiagnosed diabetes is particularly high, because symptoms often develop gradually, over years, and get attributed to just getting older. Fatigue? Getting older. Dry mouth? Getting older. Waking at night? Getting older. But sometimes, it is not age. Sometimes, it is blood sugar. And a single blood test can tell you the difference. There is one more cause I want you to know about, and this one operates entirely in silence. While you sleep. Sleep apnea. If you snore at night, if your partner has ever told you that you stop breathing momentarily, if you wake up feeling exhausted despite a full night in bed, there is a real possibility that you are spending hours each night breathing through your mouth because your airway is partially obstructed. Mouth breathing dries everything, your lips, your gums, your tongue, the delicate lining of your throat. And it is not just an inconvenience. Untreated sleep apnea significantly raises the risk of high blood pressure, stroke, irregular heartbeat, and heart disease. The dry mouth is the symptom you notice. The sleep apnea is the fire underneath. And finally, for some, particularly women over 50, there is an autoimmune condition called Sjogren syndrome that directly attacks the moisture-producing glands in the body. If your eyes are also frequently dry, gritty, or irritated, alongside your mouth, please mention both symptoms together to your doctor. This combination is a clinical flag that warrants investigation. So, we have walked through 5 real, medically documented causes of waking up with a dry mouth, and none of them are, you're just getting old. Dehydration your body can no longer detect. Medications quietly suppressing saliva. Diabetes signaling through thirst. Sleep apnea forcing mouth breathing all night. Or an autoimmune condition eroding your glands from within. Every single one of these is identifiable. And every single one of these is treatable, if caught. So here is what I want you to do. Not someday. This week. First, at your next doctor's visit, specifically ask for a fasting blood sugar test and an HbA1c. Tell them you want to rule out diabetes. Do not wait for them to offer it. Second, bring your full medication list to your pharmacist and ask directly, could any of these be causing my dry mouth? Write down the answer. Third, start keeping a water bottle on your nightstand. Drink 1 full glass when you wake up. Drink consistently through the day, not just when you feel thirsty, because that signal is no longer reliable. And fourth, if you snore, if you wake unrefreshed, if you've been told you stop breathing at night, ask for a sleep study. It is a simple test. And it could protect your heart. Your body has been speaking to you every single morning. Through dry lips. Through a parched mouth. Through that small, quiet discomfort you've been dismissing for months. It was never nothing. It was always something worth hearing. If this video helped you, please share it right now. Send it to someone you love who wakes up dry every morning and brushes it off. That share takes 2 seconds. It could change a life. And if this is the kind of content that matters to you, hit that like button, drop a comment below telling me which symptom surprised you the most, and subscribe so you never miss a video.